Thank you. Now recognize Mr. Moran of Texas.
Thank you, Mr. Chairman. Before I get to my questions, I actually want to address something that was just mentioned about having no skills and not being able to work. I'll tell you, I have kids that are now in college that had no skills when they were teenagers, and I sent them to work, and they learned skills at work, and they continue to learn skills at work. And I think one of them is not. One of them is college age, is not. And he is doing great on his own, but guess what? He learned skills at work at the age of 15 and 16, 17 by going and working in a warehouse and figuring out how to show up on time and be prepared and work hard and take directions from his supervisor. Those are the kind of skills that we need to build in our youth, regardless of whether or not they're in traditional families or foster families or adoptive families. They learn those skills at work. So there's nothing wrong with work. Let me go back to where we started today. I know the hearing is meant to highlight the need for review and reform of the John Chafee foster care program, but I know it's designed to help current and former foster youth enter into adult life by empowering them through programs that help develop meaningful life skills, obtain housing, gain employment, all that. But really, I think what we're trying to do is figure out how do we best create a scenario where these kids can find their identity, their purpose, their belonging, and find the unconditional love in life. Those are the four things that I talk to my kids about that I know that they are looking for in this life. And foster kids are no different. They're looking for identity, purpose, belonging, and unconditional love. Every child within our foster care system should have those things presented to them and a pathway to find those things in life, even through the Chafee system. I want to start with you, Dr. Jacobs. You said, when you were asked what's the most important thing, you said we need to emphasize relational health above all else. That's goal number 6 of the Chafee program. And you've talked a little bit about that. How can AI and technology help build on our goal of increasing relational health?
Appreciate that question. It does seem a little counterintuitive initially, but the way that AI and technology can help us achieve the goal of improving relational health is because technology and AI do the things that take time right now away from humans being human. If technology can take that burden, it allows caseworkers, foster parents, biological parents, and kin to actually have the time to be that human network that the children need, that youth need, after they go and they try and they fail and they try again and they fail and they try something else that didn't make sense, but they want to do it anyways. And they need to have humans that have the capacity to still be there for them. That's where technology and AI takes off that burden that would otherwise prevent humans from being human.
Mr. Lisko, in your testimony, you noted that much of the data in child welfare is unstructured, spread across case notes, and difficult to analyze. A study by the American Academy of Pediatrics found that between fiscal years 2005 and 2019, more than 3.2 million foster youth up to the age of 16 had some form of disability. In 2021, nearly 40% of foster youth in Texas alone experienced more than 2 placement disruptions, affecting their ability to build relationships we were just talking about, and complete their education, information often buried in case notes. I'm concerned about foster youth with disabilities who may not be getting connected to programs that they need. How can Augmentel's technology help caseworkers extract the information they need and piece together this unstructured data, such as identifying whether a child with a disability might need additional support?
It's a wonderful question. In child welfare, there are services that are provided both internal and external to child welfare. So developmental disabilities is provided by another area of government. This is a separate system. These systems do not talk to each other today. The way that coordination occurs between these systems, caseworker and the developmental disability program and the child welfare program, are calling each other, they're emailing each other, and they cannot coordinate the care together. So what Augmentel does is consolidates, with the appropriate data sharing permissions in place, consolidates the data for multiple systems so both caseworkers can see the entire history of that child regardless of the system that they're interacting with, so that they can coordinate the care, provide a more efficient and a more effective level of service, because AI is bringing that together for them and not requiring fragmented calls and sticky notes, et cetera, between these two agencies.
Thank you for that. I've got lots more questions, but I want to end with this quickly and just say that I believe that each one of these kiddos has a great destiny ahead of them. And it is incumbent upon us to make sure that they are directed in a way that they know that they are loved and they are supported. And oftentimes that is outside of governmental institution. That happens in the family, the faith institutions, and the institutions of economy. We are not to supplant that, but certainly to supplement and to support that. Thank you. I yield back.